This video was originally designed to be used in our clinic during an office visit. You may simply watch the video for general education, or if you plan to use this in preparation for an upcoming wellness exam, you may print out the handouts and checklists mentioned in the presentation. These are found in the Patient Education section on the website homepage. Please note, this video contains pictures of adult sexual anatomy used to explain cancer prevention health services. This may be too sensitive for younger children, and parental or caregiver discretion is advised. This video was produced on behalf of your healthcare providers at the Center for Family and Preventive Medicine, Dr. Henderson, Dr. Roach, and nurse practitioner Patricia Henderson. Among the most valuable healthcare benefits available to you are those that prevent or lessen the harm of serious disease. One of our important roles as your healthcare providers is to help you understand and take full advantage of these benefits. Thanks to advances in medical science, a number of serious and potentially life-threatening diseases can be prevented or at least diagnosed at an early stage. This can make the difference between a long and healthy life and the life that is needlessly shortened or burdened with disability. A simple test or procedure can often prevent a lengthy and costly hospitalization. In the case of cancer, preventive services may eliminate or reduce the need for chemotherapy, radiation, or surgery. An added benefit is to lessen the financial burden you may have with a serious illness. As your primary healthcare providers, we strongly recommend that you take advantage of the best healthcare available today by putting preventive medicine at the top of your healthcare priorities. The remainder of this video will present information on the major preventive services that we encourage you to consider. These are tailored to your age and gender. This information will be updated at least annually to ensure it is correct for your age and based on the best scientific information available. Therefore, we shall ask you to review this periodically in conjunction with one of your office visits. The topics covered today will be screening for breast cancer and cervical cancer, the influenza or flu vaccine. We'll also cover screening for depression, tobacco use, and touch on the important subject of advance directives. Your medical assistant will provide you with additional handouts that give you important information on preventive matters not covered in this video. This includes immunizations not provided in this clinic, injury prevention, nutrition and exercise, substance abuse, safe sex, dental health, skin health, and CPR training. The bottom line for cancer screening is that early detection equals increased survival. Breast cancer is the leading cause of cancer death in non-smoking women. The good news is that early detection can produce a 5-year survival of 98%. If the tumor has spread widely, the survival drops dramatically to 26%. These are pictures of a PET scan showing cancer that has spread widely beyond the breast, and the outcome for this individual is poor. So what is the best method for you to detect breast cancer at an early stage when the survival probability is very high? The answer is mammogram. This simple test can detect a breast cancer as long as 2 years before it can be felt as a lump. It should be performed every year. Since mammogram cannot detect a small number of cancers, you should also have your breast examined annually by your healthcare provider. The cervix is the lower part of the female uterus. The green arrow at the left points to a picture of a normal cervix. The red arrow on the right indicates the graphic of a cervical cancer. These pictures from left to right show the advancing stages of cervical cancer. Cervical cancer is virtually 100% curable and is often preventable if you have regular pap smears. There is a vaccine against the human papillovirus that has been shown to prevent cervical cancer. This vaccine is given in 3 doses and is recommended for women under the age of 27. Pap smear recommendations for women with a uterus are every 1 to 3 years if you are at standard or average risk, are every year if you are at high risk, and high risk factors include the high risk HPV infection, abnormal pap smears, or multiple partners. Pap smear recommendations for women without a uterus are: if there was no cancer with your hysterectomy, you may stop getting pap smears after 3 normal pap smears. If there was cancer with your hysterectomy, you should continue to get the pap smear every year. Please note that if you do stop getting the pap smears, it remains important to get regular well woman exams to check your breast and ovaries and other well woman issues. Colon cancer screening typically begins at age 50 unless you have a mother, father, brother, or sister with colon cancer, or you have a family history of one of the highly malignant forms of colon cancer, such as familial polyposis. Vaccinations are among the most underutilized of adult preventive services, and this deficiency is the cause of an estimated 60,000 preventable deaths in the United States every year. Today we shall discuss the influenza or flu vaccine. There are many myths and misconceptions about this vaccine. The following information is based on the best scientific information available. The first myth is influenza is not a dangerous disease, and the truth is influenza causes 36,000 deaths per year in the United States. It also causes over 200,000 hospitalizations. Another myth is the flu vaccine causes the flu, and the truth is the vaccine cannot cause the flu. This is perhaps the most common reason this vaccine is not taken. Remember, it does not cause the flu. If you got a flu-like illness in the past after taking the flu vaccine, it was likely a bad coincidence and not caused by the vaccine. Please do not let this misconception keep you from getting a vaccine that can literally save your life. The next myth is the flu vaccine is dangerous, and the truth is the flu vaccine is very safe except for persons allergic to eggs or having a history of a serious true allergic reaction. Signs of a true allergic reaction are lip swelling, breathing difficulties, or a choking sensation. The final myth is the influenza vaccine is not effective. And the truth is the influenza vaccine is very effective, with up to 70% reduction in hospitalizations and up to 85% reduction in death from influenza in vaccinated adults. The bottom line on the flu vaccine is get your flu vaccine unless there is a real medical reason not to do so, and this is actually very uncommon. You should also review the immunization schedule given in your other handouts today and be sure to get all recommended adult vaccines as indicated in that schedule. Depression is a very common mental health condition that causes a great deal of human suffering in terms of decreased quality of life. In its most severe form, it can be fatal as a result of suicide. Depression can be easily detected through a simple questionnaire, and the available treatment is safe and effective. Tobacco use is the single leading cause of preventable premature death and disability by causing lung disease, heart disease, and cancer. There are very effective treatments now available that can help motivated smokers to quit permanently. A final area we wish to present deals with the important issue of advance directives. These are legal documents. You use them to leave instructions for your wishes regarding your health care in the event you are unable to do so. There are two major forms of advance directives: the healthcare proxy and the living will. The healthcare proxy is a document that names the person who can carry out your healthcare decisions if you are unable to communicate them. You obviously should select this person carefully and make your wishes clear in advance. The living will is a document that declares your healthcare wishes to be carried out in the event of a terminal illness or a condition where you are unable to communicate. Your medical assistant will have given you a checklist that will allow you to either consent to have the service done, let us know you've already had the service, or decline the service, or you may ask for more information. There are two examples of this checklist. The first shows that you have given us an authorization to have a mammogram. The second shows that you have already had a mammogram and declined the service at this time. We hope this has answered the questions that commonly arise on preventive health services and allow you to make the most informed decision possible on these important matters.